Assalamu alaikum and very good afternoon to all of you. This is Dr. Asia, General Practitioner and Assistant Medical Director at Prime Health. International Women's Day is celebrated every year on March 8 across the globe. It is a day to celebrate women's achievement, raise awareness on many concerns. The health of families and communities is no doubt tied to women's health. But in the chaos of women's daily life, healthy living may take a back seat to course, work, busy schedules, and much more. This year, it's more important about break the bias. And at Prime Health, we break the bias with simple steps towards a longer, healthier life. Let's be together in today's webinar, which is a very significant topic. I have a power team to introduce to all of you. It is a pleasure for me. It's an honor for me to introduce my panelist for today's program, for today's webinar. Let me introduce somebody. Let me introduce by saying that she's very senior, friendly, mentor for many, Dr. Shamim Mir. She's a specialist obstetrics and gynecologist with more than 34 years of experience, worked for more than 19 years of these years in Latifa Hospital, Dubai, has been an associate professor in Government Medical College, Srinagar, India. She has vast experience in managing complicated and high-risk pregnancies and gynecological cases and many more achievements. I cannot really, say everything here. Her passion also includes teaching medical students. Welcome, Dr. Shamim.
Thank you, Dr. Asia, for your brief introduction.
It can be brief only, Dr. Ibtisam, because all the gynecologists have full book of introduction. If I start doing that, then the program will never start. Dr. Ibtisam, welcome to the program. Dr. Ibtisam Asad, always smiling, encouraging, very friendly, has obtained her post-graduation in obstetrics and gynecology from Ain Shams University in Cairo, Egypt, with now vast experience for more than 20 years as specialist obs and gynae. Also holds a master's degree in obs and gynae with a diploma in hospital management from University of Southampton Highfields campus in UK. She has an association with a lot of gynecology associations, especially with the American Academy of Aesthetic Gynecology. She has very keen interest on that. She also has published case studies in various international scientific journals. Dr. Ibtisam, if you're speaking, you're on mute.
Thank you for your nice introduction, and I'm happy to join this nice webinar trying to help all women in UAE. Thank you.
Thank you. Dr. Usha, most energetic, first female doctor from Prime Health to successfully scale Mount Everest, well known for her charitable works and whatnot. Dr. Usha Kiran, with more than 20 years of experience, UK certified consultant in obstetrics and gynae, trained, certified, and specialized in minimally invasive laparoscopic, hysteroscopic, urogynecology, cosmetic gynecology. I really cannot finish the list. People have to really visit the profile to check all the details. Gold medalist in the FCPS Mumbai University, very active in research and has presented more than 100 presentations in international conferences and a lot more. Not to miss, first time in UAE, Scarless Hysterectomy by Dr. Usha. Congratulations, Dr. Usha, and welcome to the program.
Thank you, Dr. Asia. I have to say this is a very fantastic initiative on the International Women's Day, and I really like the title, Breaking the Bias. Thank you.
Thank you. I have Dr. Varsha Oja, beautiful, inspiring, and a warrior. We all know that about Dr. Varsha. Dr. Varsha has master's has more than 22 years of experience in the field of obs and gynae, worked both in Dubai and in India. She's a member of Mumbai Obstetrics and Gynecology Society, affiliated to Federation of Obs Gynae Society of India, membership of many Indian Medical Association, member of Indian Society of Gynecological Endoscopy, also Indian Society of Assisted Reproduction. Welcome to the program, Dr. Varsha.
Thank you so much, Dr. Asia. It's my pleasure to be a part of this webinar today. Thanks a lot.
Okay, I have now Dr. Hamsa Noori. Beautiful human, calm and, hi doctor, calm and kind, postgraduate from Damascus University Hospital, have an Arab board degree in Obs-Gynae specialist with more than 12 years of experience in treating various high-risk pregnancies, infertility, recurrent miscarriages, cesarean deliveries, general Obs-Gynae, many procedures. Before joining Prime Health, she has a working experience in Saudi Arabia. So I welcome all my beautiful doctors and
Thank you, Dr. Asia.
all the powerful panelists here. I'll begin with my first round of questions because the topic is break the bias, and I would like to ask all my speakers to give a small note what they think about what does break the bias on International Women's Day mean for the gynecologist, because gynecologist has a very big role in women life from even birth to to the men, not only the menopause but to the death. So gynecologist is no less than a mother, no less than a sister in everybody's life. So break the bias is the topic of the year. I would like all of you to say something. How do you take it, and how gynecologists can really make a change in UAE for the ladies and the patients? Dr. Shamim, I would like to start with you first, please.
Yeah. So I think it should not be a slogan for Women's Day. What I feel it should be a slogan every day. Every day is ours. This what I mean by that. We must encourage everyone to challenge gender bias, which means then there should not be any discrimination between male, female, girl, and boy. We all need to take action against it, challenging everyone, ourselves, friends, families, neighbors, and on our day-to-day basis. When we are dealing with the patients, when we are dealing with their husbands, with their families, we have to see that we treat them on every day on the same basis as men. The discrimination, some of it is consciously and most of it is unconsciously. What I mean to say that we don't realize, but we are biased, maybe because of our upbringing. It usually happens. So we have to, what is the topic today? Break the bias. We have to work on it, not only today but every day.
Thank you, Dr. Shamim. Dr. Usha, your powerful words.
Hi. I'm thinking more in terms of, like you said, Dr. Asia, about gynecology per se and women's health. Now, one of the things about menopause, I would say that we women, kind of around the age of menopause, when your children are leaving, your parents are probably gone or on the way out of this world, we do find that stage in life as a very difficult thing. And I think breaking the bias comes from being more independent and finding different passions at that point of life, and looking after your health. And you can be fitter. In fact, menopause doesn't have to mean the end. It means the beginning of a new life. And that's what I want to say to women who are going through that kind of age group, that find yourself the new you in you, which is what I'm doing at the moment.
Thank you, Dr. Usha. Dr. Ibtisam.
Yes, my dear. About this time, we are coming out just from COVID issue. So a lot of women, they are coming out from this problem with a lot of stresses, a lot of concerns about this COVID, what it does, what it did for me, for my family, for my kids. So we have to take this woman back to their regular life, healthy life, screening, woman wellness, and be sure that she retain her activities. She lost her weight, which she gained more and more during COVID timing, and screening, return to her breast screening for cervical screening, so we can guide the woman to more healthy life as before that COVID. That is what we can do for most of the UAE people.
Thank you, Dr. Ibtisam. Dr. Varsha, break the bias.
Yes, Dr. Asia. To me, I actually agree with all of them. What Dr. Shamim has said, what Dr. Usha has said. Yes, being healthcare professional, the most important part of our talk always comes around the health of the female women health. Being a gynecologist, we talk about the women health in all aspects, starting from the adolescent age group, the reproductive age, the menopausal age. The health is the most important priority, but at the same time we should have a work life balance. We need to introspect and take care of ourselves in all the aspects, and that includes our health, our family life, our professional life, and beat a balance at some point of the time. I am also inspired by Dr. Usha, and would love to pursue many things. Reaching into this menopausal age group, we need to re-explore ourselves and do something actually amazing. So I'm looking forward to the changes. Try to inspire all my patients also. You rightly said that I have fought with a major challenge myself in the year 2020, and I don't feel shy in speaking about it to all my patients. Whosoever comes to me, actually, I speak about it to all of them. And looking at Dr. Hamsa also, my love to you. And so we are open to it. I mean, everyone should take care of their health, do their self examinations, do their screenings, and at the same time maintain a proper work life balance. And my best wishes to everyone around. Thank you.
Thank you, Dr. Bhusha. You're truly an inspiration, and we would like to always hear from you, because a person who goes through something is definitely the most inspiring one. Dr. Hamsa, we
Yes,
would like to hear from you.
for
Yeah.
me, breaking the bias, I totally agree also with all the doctors previously. And breaking the bias, especially for us, it's the same gender of patient, so there is no discrimination towards gender. But for us gynecologists, of course, but it is mostly about, of course, we have a lot of diversity here in Dubai. So that's why we have different backgrounds of female patients coming from all around the world, towards the towards the race, towards the ethnicity, the religion, the color, also the social level, the educational level. For us, we should treat the patient all equally. As a female ladies coming to seek our advice, our education, our point of view. So breaking the bias means for me that we will treat all the patient equally, no matter what the background of the patient is.
Yes, absolutely. Thank you very much for those powerful words. I'll move on to my next section, which is basically now question answer rounds. I'll ask my all the viewers. Thank you for joining us. And if you have any questions relevant to the topic in between, you can ask. And in between, I'm going to ask the speakers about the same. So the first question I would like to ask Dr. Usha. Uh, when we start about women health, girl health, or child health, we definitely, I think, the first time after the neonatal life, or is the girl when she attains the age of menarche. Now, this is really a serious concern, because most of the times, girls or parents don't really realize that they should come to the gynecologist, and there is a need of meeting the gynecologist. At least we are living in UAE, but most of the country, other parts, they don't feel like, it looks like a gynae problem is only about pregnancy, gynae problem is only about other things. Since you have a lot of experience and you're one of the senior gynecologists we have, how do you see this, and what is your words for parents who are today with us, especially fathers, how they should look into menarche, and what is the advice for them? Yeah, you are on mute, Dr. Shamim.
Yeah, actually, the question is for me. Sorry, but there was a mistake, I think. Anyway, I think, Dr. Asi, what you said rightly, that we cover so many things, but we don't make, especially males, father and the boys in the family, we don't make them aware about what is menarche. I'll just say a few words about menarche. Like, menarche is when you get a first menstrual bleed. So, what is our duty? That we know it happens around 9 to 14, 9 to 13 years. normally most of the girls do get periods, what we call them first menstrual bleeding. What is most important in this, that we should educate family, even the boys in the family, the girl who's in the family, and father, that this is something which is a normal physiological change. It's not a disease. It's not something that girl is going to face very abnormal, because if she is not made aware that this is going to happen to you, say at the age of 9 or 10, so that it doesn't come to her as a surprise. He is ready to accept, yes, this is a change in my body, and make her aware about normal and abnormal pattern of bleeding. What happens normally in the beginning, I have seen some of the mothers coming, if their child is getting, female child is getting periods, and she comes to you, she says, oh, she's having heavy bleeding, or she's having scanty bleeding, and the bleeding continues for months together. So we have to make them aware that this can go on for about 2 to 5 years, and maybe sometimes within 1 year it will settle down. She may not have periods for 3 to 4 months, and then she may have bleeding, prolonged bleeding. So if she is aware of it, normally what happens in our setup, that we feel uncomfortable to discuss, or the girls feel ashamed to discuss, or they think something very abnormal has happened to them by having this bleeding. So we should make them aware that this is a normal biological, or what we say as a physiological change in a body, and teach them about hygiene, teach them about, if you feel not too well, or she has some cramps, this is normal, what can happen in periods. But when to report to the doctor, when to go to the doctor, suppose god forbid she continues to bleed for a long time, say 4 to 5 weeks, that's the time you should report to doctor, because her blood levels can go down. Now, there are certain abnormalities in the same patterns. They can have sometimes periods, or what we say as first menstrual bleed before 9 years, say around 8 and 8.5 years. That is the time we call as precocious puberty. So they should report to the doctor, and then the doctor will see what are the investigations and the other things to be done for her. Same can happen sometimes late, maybe around 14, not up to 14 years. There is nothing to worry. It can be little late, but one can have a visit to a doctor. So, what is my idea is that we must educate, especially even their brothers can sometimes, if they have 2 or 3 brothers and she is the only girl in the family, we must even make the father and brothers both aware about this, that she's going to have periods. There is nothing to feel stupid about it. It has to be taken as a normal process of life. That's what I would
Absolutely.
say.
Thank you, Dr. Shamim. We really cannot go in very descriptive way, because then the topic will never stop. Since we're talking about abnormal periods, I would like to ask Dr. Varsha. So, period most common issue, when to worry and when to not for adult women. So, in general, what is the message for people to know? Because this is very important topic.
Yes, Dr. Shamim has already spoken about the adolescent age group. The period problems can vary in different age groups. There are different problems in the younger girls, the adolescent girls. There are different problems in the reproductive age, and different problems in the perimenopausal and the menopausal age group. Uh, the most one is you should know what is normal and what is abnormal. As far as the cycles are concerned, the normal cycle is the duration of the cycle. Duration is from day one till the starting of the next cycle. 28 days plus minus 7 days is supposed to be a normal cycle. Similarly, the duration of flow, 5 to 7 days, is supposed to be a normal flow, because we have seen so many patients coming to us in our clinic who get worried. They say that they have irregular cycles when their cycle is ranging from 24 to 32, 33, 34, 35 days also. So that I just want to say that that is supposed to be a normal cycle. Now, the period abnormalities which one can face is uh, in the reproductive age group. Whenever anyone has any abnormal bleeding, unusual bleeding, the first thing which we need to rule out is any pregnancy related complications, followed by one of the most common problems which is there in all the age groups, especially Nowadays, with the change in the lifestyles, with the food which we are eating, the sedentary lifestyle, lack of exercise, we are seeing many patients with polycystic ovarian syndrome. They also come with their own period irregularities. They have delayed periods. When they get the periods are very heavy because they have more of anovulatory cycles. Anovulatory means the eggs are not released. In the anovulatory cycle, there's a hormonal imbalance. There is an excess of estrogen, less of progesterone, which causes the thickening of the endometrial lining and abnormal heavy bleeding in these patients. So the other common problem is the abnormal bleeding, intermenstrual bleeding. Intermenstrual means it is coming in between the two cycles. You have bleeding, or there is a bleeding with sexual contact, postcoital bleeding, which can be seen in patients who have some sexually transmitted infections. So, any unusual bleeding, any abnormal bleeding, when your cycle length is prolonged, the duration of bleeding is more, you're getting heavy bleeding with passage of clots, continuous bleeding lasting for 10 days, 2 weeks, 3 weeks, intermenstrual bleeding, postcoital bleeding, you should always report to your gynecologist and get a basic evaluation done. Basic evaluation in the form of a local examination, ruling out any sexually transmitted infections like chlamydia and all by doing a vaginal swab, uh, then doing the ultrasounds, the transvaginal scans, and a pregnancy test to rule out any pregnancy related abnormality. So, this is the reproductive age group. And again, we should be cautious about the postmenopausal bleeding, which can be really serious and it is a red flag sign. Anyone who gets bleeding in the postmenopausal age group, menopause is the last menstrual period. So, 1 year beyond the menopause is you start with your postmenopausal age group, and any abnormal bleeding, any unusual bleeding in the postmenopausal females needs to be evaluated because the chances of malignancy in postmenopausal bleeding goes to as high as 20%. So all these things have to be taken into consideration. I think we
Thank you,
cannot go
Dr.
into more details, but
Yeah, it's a separate big topic. Obviously, we
sure.
cannot complete it, but quickly, just want to out of the curiosity, doctor, it's very important topic. Still, you think that people delay in reaching to the gynecologist, and they believe in still googling
Definitely.
and finding the symptoms of their own, though it's one of the very important part of women for around 30 to 40 years. So, do you still think that we still have that,
Definitely. That bias is there, Dr. Asiya. That bias is there. Bias in going to the gynecologist, getting yourself evaluated on time. One thing is a fear, I think. We don't go to the doctor because we are scared that something will come out. But this will not help us. It's very important to meet the doctor in time and get yourself evaluated so that even if there's any problem, it gets evaluated on time, it gets treated on time. And because, as I said, that polycystic ovarian syndrome patients, if you don't get periods for more than 3 months or the bleeding is very heavy, the lining is thick, that lining has to be evaluated to rule out any kinds of endometrial hyperplasia. Because if ignored and if neglected, it can progress into endometrial cancers also. We have seen patients getting atypical changes, abnormal changes in the uterine lining at very young age. At the age of 30 also, we have seen patients with atypical endometrial lining. Although it is more common in the elderly females, it is more common in the postmenopausal females. So don't be scared to go to
Doctor,
the doctor.
absolutely, this is a message that anything which is, beyond the normal things, but for that you need to know what is normal. Unfortunately, people on higher positions also, they deny this fact that, they don't try to seek the information what is right and what is wrong, or what is normal and what is abnormal. I think we still have to go back to the schools to know about that. With this, since you talk about, PCODs and other thing, I have a quite quick question from Mr. Ahmad. What is the most common cause of facial hirsutism before I move on to the other speaker?
Mr.
Dr.
Ahmed,
Varsha?
it is, yeah, it is the most hirsutism is basically an important sign of polycystic ovarian syndrome. We actually define polycystic ovarian syndrome by three criterias. One is the ultrasound finding, which shows a polycystic ovary. Second is period irregularities, and third is excess of male hormones in females, which results in acne and hirsutism. So hirsutism is itself a very important criteria for diagnosis of PCOS in females. But yes, not necessarily it is in PCOS only. Anyone who has hirsutism, or if it's a sudden onset of excess facial hair, it might be related to some adrenal tumors also. So they need proper evaluation by a gynec and maybe by an endocrinologist, and get themselves evaluated for that.
Thank you, Dr. Varsha. I'll now ask Dr. Ibtisam. Dr. Ibtisam, very important topic for you to discuss with. Vaginal discharge is very important and most ignorant topics, and because over-the-counter medications are available, that is an issue a lot of times, because this part is always with the women, this issues. So what is normal vaginal discharge? Anything you can share the knowledge with all of our viewers, so that it is important for them to know when it is normal, when it is abnormal.
Normal vaginal discharge, very simply, it is colorless, odorless, and it is starting from puberty, according after estrogen stimulation for the vaginal mucosa and bacterial flora, and most probably that is will act and activate the lactobacilli, which giving this lactic acid and hydrogen peroxide and other substances which gives the character of normal vaginal discharge. This normal vaginal discharge, it's white, it's milky, there is no fishy odor, there is no smell, there is no itching, and amount it's about 2 to 5 millimeter per day. It's increasing. It's first according to the ovulatory cycle. Before ovulation, it is thin, watery. After ovulation, it becomes thick. With pregnancy, it's increasing, but also there is no pain, no coloration, no smell. That is the most important character for the normal vaginal discharge. If it becomes smelly, it means there is infection. If it becomes yellow or green color, it means there is also infection. If it is become itchy, it is also infection. But if it is become bloody discharge, so bloody discharge, you have to go for your gynecologist to rule out if there is infection, if there is any suspicion for abnormal cells in the cervix. That is a serious issue. If it is bloody discharge, that is, and also there is a lot of trends in the woman that they are using some antiseptic vaginal douche. No need for that, my dear, routinely, because the genital system, it clears itself from upside down. So no need for that betadine, that vaginal douche. All this, it is obsolete since more than 20 to 30 years. No need for that is hygienic, extra hygienic care for the vagina by pushing vaginal push, and they are thinking that they are clearing their genital tract. No, they are hurting their natural bacterial flora. They are bringing more yeast infections. They are bringing more bacterial infection by disturbing the natural immune system of the genital tract. That is the main concern for the normal vaginal discharge.
I feel sad for women, because of a lot of advertisements, our woman is actually getting into infection and a lot of other things. At all stages, I believe we should believe in our gynecologist. I believe now we have phones, we have the facility of WhatsApp, and we are always connected to our doctors in today's world. There is no need to take over-the-counter medication. This has been very, very critical topic in all our webinars previously also. Please, at any cost, do not treat yourself. Do not take over the medication, even if it is really, really, if you are really in problem, you should then definitely see a doctor. With this, I will now move on to Dr. Usha. So, Dr. Usha, we spoke about most important topics. That was menstruation, that was menarche, that was the vaginal discharge. Laparoscopic surgeon. Tell me that when it comes to pregnancy, what are the important signs that may come as a surprise to pregnant women?
It's actually a very nice question, Dr. Asia. I would say no amount of reading and knowledge and information about pregnancy can prepare you for what comes with the pregnancy and childbirth. It's only when you go through it, you realize that the whole thing is a surprise, in fact.
Absolutely, especially for the first time, it is a big surprise. But more surprises on that, what it can be.
Yeah, so generally we get this impression about the pregnancy and childbirth A lot of the information comes from what we see in the movies and what we read about it. And generally, you see these beautiful-looking heroines getting pregnant. They're still looking very nice because obviously they just have a pillow in the tummy, and the body is not going through the hormonal changes. But when you really get pregnant, the body goes through an onslaught of hormonal changes, which kind of makes you feel water-tainted, makes you feel fat. So that is something that many times people are not actually realizing that's going to happen. And I do get a lot of women kind of asking me, am I gaining weight? Am I not gaining weight? So each body undergoes through different changes. So apart from the physical change, there is a lot of thing that happens in terms of the mind. And the mind is not, it's not happening just because you are going bonkers. It's happening because there's a lot of hormonal changes. For example, the progesterone hormone slows down your responses. Now, this is done by the evolutionary change. So the nature does it so that you stop doing a lot of multitasking and you start concentrating on the pregnancy and the childbirth, so that you look after the child. So women who find that they were majority of the women nowadays, we're all career oriented. So we are all very used to being very capable, multitasking and doing lots of things. Suddenly you might find that you have lost your ability to multitask, and your reflexes have slowed down. Just accept it, because it's very difficult for a capable woman to accept that she's slowing down and she's no more feeling the same energetic self as before. So I would say pregnancy needs to be taken in the flow that it comes. One of the things that you learn from pregnancy as a surprise, and which is a good thing, in fact, I learned it myself, is that to learn to let go. You learn to let go. You stop controlling, and that's how you can deal with the changes with the pregnancy. And
Dr. Usha, my specific question is, pregnancy with fibroids, because obviously you have a lot of cases as such also. Sorry to...
I did not hear that. Okay. Now,
no, I did not ask that also, but because I know a lot of my patients, a lot of our patients, it's a pregnancy with plus bonus of fibroid. So how do we really deal that? What is the advice for them?
okay. Now, first of all, if somebody got pregnant with fibroids, I would say congratulations. At least you've passed the first step, that you've got pregnant, because sometimes pregnancies the fibroids can interfere with the pregnancy. Getting pregnant itself can be difficult with fibroids. So if you've got pregnant, congratulations, fantastic. Now, it is not a scary pregnancy with the fibroids, because fibroids normally tend to grow in pregnancy. So how big they will grow is something that's very individual for each person. So you don't have to worry about it. Even if they do grow, generally they do not affect the pregnancy, unless the fibroid is situated actually inside the cavity. Then yes, the chances of miscarriages are there, chances of bleeding is there later on preterm delivery. But majority of these fibroids are located in the muscle of the uterus, and they tend to grow. They can cause discomfort and pain, but generally they do not affect the pregnancy. So fibroid with pregnancy can be quite an uncomplicated pregnancy. It does not necessarily mean you
it's not necessary that a person has to go for separate surgery for fibroid, even if it is big or small. Generally, they can continue with the pregnancy.
Yeah. So in pregnancy, and don't operate for the fibroids, and cesarean section is not mandatory for fibroids in pregnancy. They can still have a normal delivery. During the cesarean, if the fibroid is located in the area of the cesarean section, yes, it could be a little difficult for the surgeon who's operating. But otherwise, you can have a very uneventful pregnancy with fibroids. And I've had
Thank you, Doctor. Thank you, Doctor. I have a question from Sunita on the screen. Probably you can answer. How serious is stage 4 endometriosis, and is hysterectomy and oophorectomy the only solution? Would it regress or stop from worsening once reaches menopause?
Okay.
So,
hi, Sunita. So stage 4 endometriosis does not necessarily mean that you need to go for any surgical option or even a medical option. It all depends upon the symptomatology. The surgery is advised for any endometriosis, for that matter, only if your symptoms are unbearable. So depending upon the age, and if you are going to almost, more than 40, 45, yes, if the pain is intolerable and you've already tried all the medical options, yes, hysterectomy and removal of the ovaries, that is going to be a solution, a permanent solution for the pain. However, if you are not that symptomatic, you don't have to have a hysterectomy. You can observe it, you can have medical management. So it's not a must that you should. And it's not a serious condition. It is a painful condition. Stage 4 endometriosis is a painful condition. It's not a serious condition at all.
So we can always treat with the best possible medications. It's just that please reach to doctors at least on time. That's what is the most important thing. Unless you don't go to doctors, you will never get the answers and you will never get the treatments.
Yeah, you need to make sure that it is endometriosis, not something else. And yes,
Yeah.
it can regress after menopause. So if you're almost reaching menopause, waiting for the menopause might be a treatment for endometriosis.
Thank you, Dr. Usha. Now we have finally reached to the ANC checkups. Dr. Hamza, after pregnancies, the ANC is a very important topic. What is the recommendation for all of us to know?
Antenatal care, which is ANC in pregnancy. It is very important. The main goal when they settled out to start ANC for pregnant ladies, which is antenatal care, was to detect a high-risk pregnancy in specific and to deal with any complication that can be related to this high-risk pregnancy. And this goal over the years has been proven as a good tool to make the outcome of pregnancy for the mother and for the baby as good as possible. And it make really good change in the practice of obstetric towards the pregnant ladies. For other very important points for follow-up in pregnancy and getting good antenatal care is to promote and maintain physical and mental and social health of the mother and the upcoming baby by providing education on nutrition, on personal hygiene, and on birthing process. The second most important goal of antenatal care is to detect and manage any complication, either obstetrical, surgical, or medical for the mother, and to develop birth preparedness that we will prepare for this upcoming baby. And if any complication towards delivery to be talk about, educate about, and try to predict before that to deal with while in delivery. And the last thing that I want to emphasize on for antenatal care is to prepare the mother to breastfeed, to deal with this new experience, which is a new baby coming, to have education about the puerperium, the breastfeeding, to take good care of the baby, again, physically, psychologically, and socially.
So absolutely, ANC doesn't only mean going to doctor and have regular visit, but also to means that you should have a balance of all aspects of life. Thank you, Dr. Hamza. Dr. Shamim, I have a question on screen. I would like you to answer on that. Miss Nimba Qureshi is asking. She is 26-year-old, and she has some questions regarding periods. Bleeding for 7 days, have unbearable pain whole time. I get infections a lot. So this is half the question, but I'm sure that you still have answers for Ms. Qureshi.
I know, well, she has three questions. One is that she's getting bleeding for 7 days. And if I understand, she says she gets pain during periods. And number three question is she's getting repeated vaginal infections. Well, I'll try to be brief, but if she's if she's getting bleeding for 7 days, well, it depends. Sometimes periods can last from 2 to 7 days. So it depends how much flow she has. The only way to know is to go to the gynecologist. We can rule out, as Dr. Usha mentioned, sometimes because of the fibroids, also patient can have an heavy bleeding, what we call as menorrhagia. So he needs to have at least one visit. The second thing is he should do. Sometimes people say, I have heavy bleeding. We ask them, how many pads do you soak? They'll say little bit, only one or two. So best is to go for a checkup, rule out any other pelvic pathology. If there is nothing, having flow for 5 to 7 days is acceptable. But same time, do one hemoglobin, say before periods, and then repeat it in mid-cycle. Then that will give us a clue that is she really having heavy bleeding if her hemoglobin is falling after periods. Second is vaginitis. Dr. If Sam has given a big lecture on vaginitis, I don't need to repeat it. And, and the third question is cramps. Cramps most of us get, but if it is again unbearable, she is not able to carry on with work. She can always visit Dr. Usha and she will do a laparoscopy. Maybe she has endometriosis.
Okay. Thank you, Dr. Shamim. I have another question I'd like to ask Dr. Varsha about the same. Just a second. Dr. Varsha, I have a question on screen. Yeah, here it is. Kindly explain ovarian cancer prevention methods, annual screening test. Mr. Siva is asking, any vaccine available in market to prevent cancer?
Yeah, Mr. Siva, coming to ovarian cancer is actually not so predictable. Until and unless you have a very strong family history of ovarian cancer, yes, there are some tests which can be done. There are some genes which are associated with ovarian malignancies, the BRCA gene, BRCA1 and 2. If you have a very strong family history in first degree, second degree relatives, especially on the maternal side of ovarian cancer, you can get yourself evaluated for these genes, and in case it comes positive, then you need to complete the families early and take some decision about the ovaries and get regular investigations done for the ovary. Now, coming to the prevention and the screening methods. One is you should report to your gynecologist in terms of any abnormal, unusual symptoms. Most of the times, the ovarian cancers are late to present, unfortunately, and this is the most common cause of gynecological cancer related deaths in females. So, it's very common to have an ovarian cancer diagnosed in a later stage. Anyone who has any unusual symptoms, feeling any lump, any abnormal bleeding patterns, bloating, weight loss, should report to your doctor and get the at least a basic ultrasound done, basic abdominal ultrasound done. Second is, if you have a family history, then you need to be a little bit more careful. There are some tumor markers for ovarian cancer, like CA125. There are some tumor markers which are raised when you have an ovarian malignancy. So you can be tested for that. The most common diagnostic criteria for ovarian cancer would be an ultrasound, a transvaginal scan, which can actually pick up the ovarian cysts. Ovarian cysts are very common, and most of the times, more than 80% of the times, it is benign. But ovarian cancers are picked up in the ultrasound only. And if there is any suspicion of having an abnormal, unusual ovarian cyst, which appears more like a malignant ovarian cyst, then you might need to do further investigations in the form of CT scan to rule out any spread and then decide the line of management. That is important. As far as the vaccines are concerned, there is no vaccine which is available for ovarian cancer. Vaccines are available only for most of the infective diseases. So it is there for cervical cancer, which is related to the infection with a virus called human papilloma virus. But unfortunately, for ovarian cancer, there is no vaccine which is available. It
Thank,
needs a close monitoring, close follow up. Any unusual symptoms, get yourself investigated. Ultrasounds, the most important way of investigating the ovarian cancer. And in case it is a suspicious ovarian lesion, then uh, it's very important to decide the line of management. I mean, very most of the times our patients, they come to us, they always want a laparoscopic surgery, they always want a keyhole surgery. But unfortunately, we cannot offer keyhole surgery to all the patients for all the symptoms and all the diseases. Ovarian cancer is one such disease in which we usually recommend an open surgery so that there is minimal spill inside the abdominal cavity when we are doing the surgery, and we get the maximum results out of the surgery. So
thank
the
you,
first
Dr.
surgery should be very good. Yeah.
Thank you, Doctor. I would like to update my speakers that we are really running out of time. I have still a lot of questions to ask. We'll be a little more precise because we have a huge engagement today on social media. a lot of people are with us since beginning, and they're still continuing to be with us. And questions are also coming, because I believe it's already diagnosed thing. So I'll request my all speakers to be very precise and to be very quick, and will not go into details. Dr. Ibtisam, I believe Ms. Maqsood is trying to ask that body weight is a problem. She has one baby now, not getting pregnant again. What is the recommendation for such women?
See, my dear, for that patient, she is giving also that she is having one baby, but she didn't give how old is that baby and cesarean or normal delivery. That is one issue. She has regular cycle or not regular cycle. If she has PCO before, so for that issue, she has secondary infertility according to her history. Secondary infertility might be hormonal disturbance, might be hormonal disturbance. She might have thyroid disorder, she might have PCO, she might have any reason for irregular cycle. So we have to check her hormonal status. We have to see her if she has some concern in her uterus, some uterine problems, if she has any adhesions, if she has delivery by cesarean before, she might have this pelvic adhesions which delay her pregnancy. So she has to be assessed by a gynecologist nicely. Detailed history, detailed examination, checking her hormonal status, checking her ovaries, and checking her tubal patency. Then she is telling that she is gaining weight. Gaining weight, it means that she might have PCO, she might have thyroid disorder. We have to diagnose which is which. Then encourage her to increase her exercise, to go through diet, whatever the diagnosis. PCO, she has to be managed. Hypothyroidism has to be managed. And if there is any peritubal adhesions, she has to be managed also either by laparoscopy, and she has to be seen by a gynecologist as soon as possible, my dear.
Thank you, Doctor. Dr. Shamim, very important topic, contraceptives, but will not go into the detail. But the current is implant NXT. I want you to tell us the most quick and most informative information what we do at Prime and how this can really help a lot of our patients who would like to avail such opportunity, I'll say.
I'll be really brief. See, we have got many contraceptives which we advise women. It's a small gap. Contraception means a small gap in a delivery, not to have immediate delivery. This implant NXT has been being used for last maybe more than 15 years, and it's a very easily acceptable, most recognized form of contraception, and efficacy is very good. We don't need to remember that like we have a pill that every day we have to take one pill. It's easily inserted, easily reversible, easily patient can herself feel. We give this in one of the arms about the elbow. Small, it's a very, very easy procedure, takes about 5 to 7 minutes. And the only thing, sometimes patients may get spotting for 1 or 2 months, or sometimes they may not get periods for a long time. Its efficacy is for about 3 years, but that doesn't mean that we cannot remove it before that. So I would encourage ladies that this is quite effective with high efficiency and easily inserted, easily we can remove it. Should accept this contraception. I think I've been very brief, Afia.
What is the contraindication? Who are the people who should not come for
The
this?
patient is having already some abnormalities, irregular periods, or she has got fibroids, or patient is having sexually transmitted disease, then we should not. If a patient is a regular period and a normal flow, we can insert anytime, but best is to get it inserted around fifth day of cycle, because the only thing then we are sure that she is not already pregnant.
Okay,
Well, we
thank you,
can
Dr. Shamim.
lactation.
That was really quick, Dr. Shamim. Dr. Hamza, this question, Miss Montes is asking. Hi, doctor. I would like to ask, as I have hyperthyroidism, it is controlled by endocrinologist. But I would like to ask, will I be able to have normal delivery, or should it be cesarean section?
Yeah, so this is very easy question. For this one, I will answer directly to that. As long as it is controlled, usually hyperthyroidism will not interfere with the way of delivery. Your way of delivery will be controlled and will be decided towards obstetrical issues only. So if you have any obstetrical issues, like the baby is not coming with the head, for example, breech, upside down, or transfers, or the placenta has coming before the baby, this is obstetric issues or problem that can cause you to have cesarean section. Rather than that, hyperthyroidism doesn't interfere with the way of delivery. You can go and proceed for normal delivery.
Thank you, Dr. Hamza. Quick one, Dr. Usha. We back. A lot of people have requested to know, and we also requested, because in today's current time, most of the people go for cesarean section, and this is something very unique. A quick one for all of us to know.
Okay, I'll just say about 2 or 3 things about VBAC, which is vaginal birth after a previous cesarean section. If you have had one cesarean section, second time doesn't necessarily have to be a cesarean section. There's a very good 70 to 80% chance of having a normal delivery. I've had a cesarean section first time, and I've had a normal delivery myself. So, and I'm a great support. Second thing, obviously, we can't say that from the beginning, not even for the people who have not had a cesarean. It needs to be assessed around 36 weeks. If everything else is going fine, they're fit to go for a trial. Third thing is, we can guarantee 100% trial. We can't guarantee 100% vaginal delivery, not even for the people who have not had a cesarean before. But yes, it's worth trying, and it can be very successful.
Thank you, Dr. Usha. I have one question, about the fungal infection. Probably Dr. Varsha can answer this, because I can have a mix of questions. Dr. Farhana is asking, I have one question, how long fungal infection will get rid of? Very important question. I think most of the people...
Yes, Farhana, for persistent and recurrent fungal infections, maybe you need to get the treatment for a longer duration of time. Sometimes, if you're getting fungal infections recurrent more than 4 times in a year, then you need to have a proper consultation with a gynecologist and a longer duration of treatment. And rule out the reason why you are having this recurrent or long fungal infection. Maybe you have abnormal sugars, maybe you're diabetic. So that also has to be ruled out. And that's it, I think.
Thank you. Doctor, I would like to ask what happens during cesarean section, because, a lot of women have this phobia, cesarean normal delivery. Generally, what do we expect in cesarean section? What is there for what women need to know?
See, cesarean sections can be either it can be an emergency cesarean section or an elective cesarean section. We know that it's the delivery of the baby through the abdominal incision, and as far as the elective cesarean sections are concerned, we do it in case there is a malpresentation, like baby is in the breech position or in the transverse lie, or the placenta is low down. In that case, we do the elective cesarean sections. Otherwise, we try for 100% trial for the normal delivery, as Dr. Usha said. So we try for the normal delivery. In case there is a failure to progress, we go in for an emergency cesarean section, either due to maternal indications or due to fetal indications. Emergency cesarean sections are always more complicated as compared to the elective cesarean sections. The risks of complication is 2 to 3 times more in an emergency cesarean section as compared to an elective cesarean section. There is more chance of blood loss in a cesarean section delivery. If you're doing an emergency cesarean, there is more chance of distress for the baby also, because the baby is deeply stuck into the pelvis, about to get delivered normally, and then you are delivering because of some reasons by a cesarean section. There is more chances of extension of the uterine incisions. So the blood loss is usually a little bit on the higher side on the cesarean section. But as far as what to expect in a normal cesarean section, I would like to tell to my viewers and patients that most of the times the cesarean sections are also not so complicated. The patients they do really well. After the cesarean section, we allow them to have their normal meals very early, as early as possible. We remove the catheter which is there in the bladder as early as possible, and try to mobilize them. They are able to take care of their babies, they're able to breastfeed their babies, and we try to mobilize them at the earliest so that they don't get blood clots in their veins. They might be taking the blood thinners for about 7 to 10 days, even at home, because there is an increased chance of blood clots after a cesarean delivery, more than in a vaginal delivery, but usually the recoveries are good. For one cesarean section, as Dr. Usha said, yes, the chances of having a recurrent cesarean section increases. If you have a vaginal delivery, it's more likely that you will have a consecutive normal vaginal delivery. With a cesarean section, there is 70 to 80% chances that you have a successful uh, vaginal delivery, still 20% chances that you end up into a cesarean section after having a first cesarean delivery. So
Thank you,
usually
doctor.
it's a good recovery.
Thank you, Doctor. Dr. Hamza, direct question for you is by Al Hiti. What are your thoughts about exercising during pregnancy for someone who's usually active before pregnancy? So,
Yeah, for
yeah.
exercise in pregnancy, it is fine. It's not dangerous for the baby. But what kind of exercise that is most safe in pregnancy usually is walking, and also jogging. Swimming is also safe in pregnancy. Yoga is safe. You can go shopping, for example, in malls and go to the shop and come back. It's all fine in pregnancy. Pilates is also good exercises. So these the most more safe exercises in pregnancy usually. Of course, not for all pregnant ladies. Some ladies must restrict their activity during pregnancy if they having complication with the pregnancy. But for low risk pregnancy and most of the pregnancy exercises is recommended. It's very good. It keep you healthier and it's not dangerous for the baby. Towards swimming only, we don't recommend sauna and jacuzzi and scuba diving, which is going deep into down the water. But all of the other exercises I spoke about, all the pregnant ladies, even the one who are not really active before pregnancy, can do it safely.
Thank you, Dr. Hamza. Another question from your patient is, how can mothers be best prepare for their delivery date to ensure better recovery after delivery?
So this one will just follow up in pregnancy. What we spoke about is antenatal and go to your visit regularly. The doctor will educate about everything, about nutrition, about activity, exercises, about recommendation later for any concern about the way of delivery, about if any complication can occur depending on your situation during the antenatal care progress, birth plan you will put with your obstetrician also to come out with the best result for you and for your baby. The breastfeeding plan also will be put even from the antenatal care visits, and to ensure the best recovery after delivery. This will be carried out through all visits through the 9 months of pregnancy with your obstetrician. A lot of instruction we give to make sure everything will work out fine and perfect for the mother and the upcoming baby child.
Thank you. Dr. Ibtisam, question for you. Does being overweight can cause miscarriage and does it have effect on progesterone level?
Yes, my dear. Obesity, it can affect pregnancy, it can cause miscarriage, it can cause abnormal progesterone because pregnant obesity, it means fat cells. Fat cells always producing extra estrogen, and it is unhealthy estrogen, which lead to anovulation. This anovulation, it might prevent pregnancy, it might delay pregnancy, and after ovulation induction, if she get pregnant, higher risk of abortion is present there. So also there is the weight-based effect. It is associated also with obesity and overweight. So controlling weight is one of the most important issue in the woman life. Control the weight, healthy lifestyle, practice exercise. All this, it will prevent hormonal imbalance. So it will prevent miscarriage.
Thank you, Doctor. Dr. Shamim, postpartum pregnancy. Sorry, postpartum depression. Sorry.
That's fine. I just wanted to add something that I got out of this thing. I want to announce here that as somebody asked Dr. Hamza a question, we have a regular antenatal classes. Before they would be physically there, but now they are online. So anybody can attend these classes by booking antenatal classes from the reception. Then comes my topic of postpartum depression. Well, it's one of the very, very important topic I really wanted to talk about because it's very much being ignored and people are unaware about it. We do get patients pregnancy itself is a very good feeling that, when we deliver a baby. But at the same time, it becomes a very stressful condition for mother. She's deprivation of sleep, looking after a newborn. So sometimes they get into a depression. In fact, most of the ladies do have some mood changes after they deliver. So the awareness is very, very important to recognize. They get irritable. Sometimes they look very in a tearful conditions, anxious, and excessively worrying about their baby, that somebody will take away their baby. So for us as a doctor, it's very important, and for the family members, to recognize that possibly this lady is going into a postpartum depression. Now we have to decide. Some will need just only counseling, family counseling. Husband has to be counseled, and to be always to have people around her. And sometimes it needs to be referred to psychiatrist when we feel the lady is really in such a depression. It's all the clinical condition. Recently, I had one patient who went home very happily, came back with acute abdomen. She did not need thousand investigations. When I examined her, I spoke to her, I could make out she is in depression when she gave me her whole story. So we need to really be careful with postpartum depression. Sometimes they can get suicidal tendencies. So
Absolutely.
keep in mind, and they can even be harmful to their own baby. They lose interest in themselves. Starts around third, fourth day of postpartum and can get into peak by second week. So they need, and there are very safe medications which we can give to mothers even during lactation. So I say, one second, we need to recognize it, and we need to refer these patients to a psychiatrist and not ignore. Awareness is very, very important.
Yes, absolutely, doctor. That's what we are all here about. Gynecology is a vast topic. I cannot complete in 1 hour, but I still, try to get most of the topics over it. Doctor, if you don't mind, can you answer the question on the screen? Basically, Miss Aban is confused about calculation of the ovulation cycle in general.
Is it for me?
Yes, doctor. Doctor.
Yeah. This is one of the topics I really like. See, people have nowadays calendar, they do ovulation tests and all those things. But what I really feel is most important, that a lady has to, in a simple way, roughly, if she has a regular cycles, so some people can have 21-day cycle, some people will have 24-day cycle, some will have 28, as Varsha mentioned, cycle can vary. But they have a regular cycle, so they should roughly calculate their expected date of next cycle, go 14 days backwards. There are many tests, many things we can do, but this is the easiest way. That will be an ovulation day. I repeat, roughly calculate the expected date of your next period, go backwards 14 days. That's your ovulation, and add 1 day here and 1 day there. That will be the right time of ovulation.
Thank you, Doctor. Dr. Usha. Uh, very, very, very important question. And first of all, congratulations for being the first gynecologist achieving something we call Scarless Hysterectomy. I think you better can say, you better can aware us about it in general. And overall, how you are the only one right now, I believe, in UAE, if I'm not wrong, please correct me, and how it can benefit overall ladies. Scarless hysterectomy. Over to you, Dr. Usha.
So hysterectomy is the removal of the uterus, and for various reasons, you might have an indication to have the uterus removed. Where originally we used to do the hysterectomies from below, which is the vaginal hysterectomy, which was for uteruses which are not very big size, and there is some amount of descent from below where we can do it that way. That used to be scarless, but it is not feasible to do that scarless thing in everybody. So then came the where we would open the abdomen, which is an abdominal hysterectomy for large uteruses and the ones which couldn't be removed from below. And then, as a revision to give a lesser scar, came the laparoscopic hysterectomies, where we have only 4 small holes. We use a keyhole surgery, so we use a telescope and do that. Now, the recent scarless hysterectomy, which is called the V-nose hysterectomy, is basically an extension of the original vaginal hysterectomy. So now the vaginal hysterectomy, which used to be possible for only certain category of uteruses, is now possible for almost everybody. I say almost everybody, not everybody. So basically, we use the telescope from below through the vagina, so the patient does not have any scar at all. Obviously, we need to assess who is fit for to have that kind of a surgery or not. Not everybody can have a Scarless hysterectomy, but in the current times, we at the Prime Hospital are the only ones in the UAE who are providing the service. So I would say anybody who's requiring a hysterectomy should consult and find out, and we can assess whether it can be done scarlessly or not.
Thank you, Dr. Usha.
The advantage of that is because there is no scar, the recovery is going to be much, much better than the open hysterectomy, obviously. And then even compared to the laparoscopic hysterectomy, a scarless one is going to be much better. I wouldn't say totally painless. It's scarless, not painless, but it's going to be better recovery.
Thank you. I am really running short of time, but the topics were, I believe I have to do second round, but since we are running out of time, I would like all the speakers to please give your take-home message to all the viewers. So Dr. Usha, I'll start with you, please.
I think I've already put my take-home message on the Facebook today. On the Women's Day, I would like to say that I'm proud to be a woman. And I would like to be a woman. I don't want to be a man ever, and I don't want to be compared to a man. I don't want anybody to give me my rights. I'm born with it, and I would like every woman to think like that. Thank you.
And you will also make us learn how to really go next time to Kilimanjaro. You'll take all of us with you.
Next one is Machu Picchu.
Definitely. Dr. Hamzat, your take-home message, please.
I just want to say Happy Women's Day to all the women in the world, and I hope every day will be Women's Day. We have a lot to give and to offer the community. We are the mothers, the daughters, the sisters, the wife of everyone, and we are contributing greatly and very effectively in the community. And I hope all the women very happy Women's Day.
Thank you, Doctor. Dr. Ibtisam, I always request you in English and Arabic both, please.
My dear, it's not only 8th of March, it's Women's Day. Every day is our day. So,
yes.
Yes.
Absolutely. It's our day, definitely.
Every day is our day. Others, they have only one day every 4 years. So it's only our day every day. You are a woman, you have to be proud of that. You are half of the community, but you are the mother, you are the daughter, you are the wife, you are the sister, you are the creative part in this world. Be happy, be strong, be healthy, and care yourself, care your family. And by this way, we will be one of the best countries.
Dr. Ibtisam, request to speak in Arabic also.
Yes, my dear, in Arabic. احنا يوم المرأة العالمي مش بس 8 مارس، يوم المرأة العالمي كل يوم. احنا اليوم العالمي للمرأة يوميا. يعني انت العمود الفقري بتاع البيت، العمود الفقري بتاع المجتمع، بتاع الأسرة. يعني لو انت سليمة وشايفة صحتك كويس وعارفة تراعي بيتك، عارفة تراعي أولادك، عارفة تراعي زوجك، يعني بالطريقة دي هيبقى في أسرة سعيدة، بالطريقة دي هيبقى في مجتمع من أرقى المجتمعات في العالم.
مرحبا. Dr. Varsha.
Yeah. I wish all the happiness and good health to all the patients, all the females around. I would just say keep smiling, keep spreading happiness around you, and do the best for yourself. Take care of yourself, take care of your health, take care of everything, and enjoy life. All the best to everyone.
Thank you so much. Dr. Shameen, your take-home message.
Just remember, equality for women is equality for everyone. And as Dr. Ibtisam said, it's not just to wait for a Women's Day. Every day is our day. And we must take care of ourselves. Then we can take care of our family and everyone. That's it.
Thank you so much. With this, I really feel empowered today to end this session. I would like to tell all of you that yes, it's not about today only Women Day celebration. Every day is Women Day celebration. We are the epitome of, house, family, work, profession, or anything. We have to really be good. We have to be empowered. We have to be empowered with a right health education. Take care of your health. Stay safe. Stay healthy. We will see you soon on our next webinar. Thank you. Thank you. Thank you so much for joining us today.
Thank you. Thank you for
Yes.
everyone.
Thank you.
Thank you.